The chair now recognizes the gentleman from Texas, Representative Veasey, for 5 minutes of questioning.
Thank you, Mr. Chairman. Mr. Secretary, this country is in the grip of an opioid epidemic that's ripping through America. It's gutting our schools, it's shattering our neighborhoods, and it's tearing families apart. Between 1999 and 2019, overdose deaths involving opioids skyrocketed over 500%. And this epidemic has not discriminated. It doesn't care if you're rich, if you're poor, if you're black or you're white, if you're Democrat or Republican. It takes veterans, mothers, students, and children. Over 240,000 children have lost a parent to opioids, an entire generation grown up with grief and trauma, and over 42,000 veterans lost to overdose. And now, instead of strengthening the VA, the administration you work for plans to gut it, cutting 80,000 jobs, cutting resources from heroes who fought for us. In 2020, 48,000 Americans died from opioid overdoses. Despite historic progress under the Biden administration, where overdose deaths dropped 65% from 2023 to 2024, this administration now plans to cut critical programs and fire behavioral health and crisis specialists, threatening to strip hundreds of thousands of veterans of life-saving treatment to prioritize billionaires over those who served. But most egregiously, in the FY26 budget, the Trump administration is proposing to slash over $1 billion from the Substance Abuse and Mental Health Services Administration. That is literally $1 billion ripped away from treatment, prevention, and hope. Mr. Secretary, you don't slash lifelines in the middle of a rescue. You don't call 911 and hang up halfway through. And you sure as hell don't preach about redemption while cutting the funding that makes redemption possible. So let's be clear. This isn't a budget, it's a death sentence. And now I have a few questions for you, Mr. Secretary. Mr. Secretary, do you believe the United States is currently facing an opioid crisis?
And that's why I've reauthorized.
So you do. So do you believe the federal government has a responsibility to combat this crisis, yes or no?
The federal government has a role in it, certainly.
Thank you.
An important role.
Mr. Secretary, you're aware that the president's own brother died from addiction. You've heard J.D. Vance, the Vice President of the United States, talk about his mother's addiction. And you've talked about your own history and your own addiction issues in 1983, where you sought treatment for heroin addiction at a rehab facility in New Jersey. Was that treatment effective for you?
I've been sober.
Okay.
I also would point out that I lost a brother to this disease. It's a priority for me, and it's going to be a priority for HHS.
And let me also ask you, do you believe, yes or no, do you believe that structured recovery programs were essential to your own recovery?
My recovery program was mainly.
Yes or no? Do you think that was important for your own recovery?
It was important.
Okay, so Mr. Secretary, overcoming addiction is commendable. I've had family members that have overcome addiction. I commend you for that. But not everyone have the resources that your family has to get the care that they need. And because you know better than anyone that recovery without treatment is challenging at best. So, Mr. Secretary, please tell me, why would you deny millions of Americans the same access to care that saved your life?
We're not denying anybody access to care, Congressman. We're shifting some of the funding away from SAMHSA to the states. The addiction problem in West Virginia is very different than the addiction problem in
Let me ask you this, Mr. Secretary. You've credited the 12 steps in your recovery. So can you tell this committee what is step 4?
It's making a fearless inventory.
Is making a fearless inventory of ourselves.
Yeah.
And you remember that one. And do you remember step 12?
Yeah, it's having had a spiritual awakening, we try to help other alcoholics and addicts.
So tell me, Mr. Secretary, yes or no, does cutting off treatment for people still suffering align with step 4 and step 12?
We're not cutting off treatment for anybody, Congressman. As I said, I'm happy to explain it, but you don't give me any chance to answer questions, which is part of the game that we play here.
Mr. Secretary, I've heard your story. Again, I think that it's great that you talked about your recovery. But, man, you can't pull the ladder and shut the door. There are people like President Trump's family and your family that have resources, but there are families like mine and Secretary Vance's.
Gentleman's time has
As we
expired.
said, we're not denying,
ladder
we're
up.
Time has
not
expired.
taking treatment away from anybody.
The subcommittee